Hi, welcome to my channel. Thank you for tuning in. God bless you. Today I'm going to be talking on glaucoma. What is glaucoma? Glaucoma is a group of eye diseases in which the optic nerve is damaged, leading to irreversible vision loss. Okay, so what is this optic nerve? Through the optic nerve, visual information is carried from the eye to the brain. Glaucoma is the second most common cause of blindness worldwide, so it is very important that you are aware and you know about glaucoma. Okay, so what are the risk factors of glaucoma? One is family history. If there's someone in your family that has glaucoma, you better go to your ophthalmologist and get your eye checked, because there's high probability that you have glaucoma. Okay, and I want you to know that glaucoma causes progressive vision loss. So the progression of the disease can be stopped, but the part of the vision that is lost cannot be restored. So that is why it's better you check yourself on time. Another risk factor is age. Another risk factor is trauma. If you have trauma to your eye, you better get your eye checked by your ophthalmologist. It's very important. And in most cases, glaucoma is caused by increased pressure within the eye. So the eye produces a fluid called aqueous humor. The fluid is necessary within the eye, but in a case where there is imbalance between the production and outflow of this fluid, it could lead to glaucoma. Okay, so it's very important to know that. And how can it be diagnosed? How can you know that you have glaucoma? Glaucoma might not necessarily present with any sign or any symptom. That is why it's very dangerous. It's a dangerous disease because you might not know on time. You might not know you have glaucoma until you get your eye checked by your ophthalmologist. Okay, so what is the treatment of glaucoma? As I said earlier, the progression can be stopped, but the part of the vision that is lost cannot be restored. Okay, so your doctor will prescribe some eye drops for you, and I don't want you to prescribe drugs, or maybe someone you know has glaucoma and you feel like the person can, or you feel like you can use the same eye drops or the same drugs that the person is using. No, as I said, there are some contraindications to every drug and there are some indications to every drug. So don't just use any eye drop. Get your eye checked, and whatever eye drop that your doctor prescribes for you is the one you should use. Okay, thank you very much for watching. God bless you. Bye bye. See you in my next video.